I didn't have one moment where I was like, aha, I want to be a doctor. It was several things adding up. So I had some exposure to healthcare when my grandfather was being treated in hospice for cancer. And that was where I was like, this is just super interesting. It's crazy that this human body works at all. Pediatrics surprised me because it married both of those pieces of things where you have problems that you can easily go in and fix, like an ear infection or dehydration, things like that, where it's a concrete solvable problem. And then on the opposite side of things, you get really interesting rare diagnoses. So you get kids with genetic disorders, things you've never heard of before, and no amount of training could have prepared you to hear about it before. And you have to go look that up and do that piece of learning for each individual patient with those rare diseases. I think one of the reasons why it's important to have a good relationship with your pediatrician is because this is going to be a long-standing relationship for you. This is going to be something from when your baby's first born, where you're going to have a very specific set of concerns then to when you're dealing with a teenager in your house, and that's a different set of concerns too. And a lot of what we do is an evolving process. I don't think a lot of people realize oftentimes my plan is to check in and see where are we at after a week of trying this, and so I need you to communicate to me, is what we implemented actually effective or not? So it goes both ways in terms of the communication for us to have success. The best part about being a pediatrician is just the interactions I get to have day to day with all of these wonderful kids. I have the cutest patients, and I get to learn about dinosaurs and princesses and all sorts of fun things. There's never a dull moment. There's always something exciting going on. I'm Sumiko Rueger, a pediatrician practicing at Intermountain Health.